Hello, guys. Welcome to another lesson in the OET course. In this lesson, we are looking at the best approach to writing the letter that you're required to write during the subtest. This is the best approach we can give you, but of course, there are options for you to select from. It's not a straight jacket best approach, option that we are giving you. They are, varied ways of approaching the best that we are giving to you. On the whole, your focus should be on bringing the attention of your recipient to the key information. And this is done when you logically select and organize relevant case notes that you have in the question given to you. So now let's look at what to do. For the writing subtest, you're given case notes and or relevant documentation. And this gives you information about the patient. It includes necessary and irrelevant information. For example, you would have the name, age, and other details such as marital status, admission and discharge date, reason for admission, social and medical history, medications, nursing management and progress, assessment, discharge plan. This provides you a whole lot of information about the patient that you are supposed to write the letter based on. So, what questions should you answer even as you set out to write the letter? First and foremost, you need to read the writing task given to you. And that comes immediately after the case notes and or relevant documentation. Usually, read that. It will tell you what you're supposed to do. For example, you're writing a letter to this person, telling him or her about this person, or you're referring this patient to Miss Samantha Brune or whatever. It tells you exactly what you should do, and that is the writing task. So after reading that during the first 5 minutes that you have, you're not spending all the 5 minutes just reading the writing task. Just, a couple of minutes or seconds, and you should be done reading the writing task and fully understanding it. After that, ask yourself these questions. What is my role as the writer of the letter? What is my role as a writer of the letter? So if you're a nurse, you're writing the letter as a nurse. If you're a doctor, you're writing the letter as a doctor. If, let's say, you're a specialist, you'll be writing from that angle. Who is the recipient? Am I writing to a specialist, a care home, a senior nurse? Who is the recipient? Who is the intended reader of the letter? And what is the relationship of the intended reader with the patient? Is this the first time that they are getting, they will meet at some point, or they know each other to a certain extent, because this is not the first time the patient is going to that facility. You need to be aware, and that would be told you in the writing task that you have. What is the main point I must communicate to the reader? You need to know, based on what the intended reader will have to do for the patient, you need to know what information, what main information you should put across. And then what supporting information is needed, is necessary for the reader. What background information is necessary for the reader to know? So you're looking at the main point, the supporting information, the background information. All of this come together to form the relevant case notes. The relevant case notes are not just the primary information the person needs. Probably the person needs a background to this, or needs a future plan as far as taking care of the patient is concerned. You need to know and arrange them accordingly. So if it's the main point, if it's a primary, then of course it comes, then the secondary comes, then the associated ones also follow in that order, so that you can effectively communicate with the intended reader of the letter. Then you should ask yourself, what is the best way to present the information? We'll look at some of the ways very shortly in this particular lesson, so that we understand how best to communicate with the person, how best to organize the information that you have, so that it's easier for you, for the intended reader, to get the necessary information. Because of course you're working with time. I mean, in the real workplace, health professionals are always on the run, you know, taking care of that person, taking care of the other person, and so they wouldn't have the whole day to, you know, read whatever it is you've given to them. So that should be a mindset when you're writing the letter, so that you don't include irrelevant information, and you don't unnecessarily also expand the relevant case notes that you have. It should be concise, straight to the point, very precise, not just, you know, going round and round the whole thing and not really conveying the information that you need to. If the comprehension of the intended reader is impeded because of something you have included, because of something you have said, you know, too long, then of course it will affect your ultimate score for the sub-test. Let's look at the implementation of this. After you've read a task, which is your focus, which is the primary thing you're looking at. After you've read that, what are you supposed to do? First of all, you need to analyze and select the relevant case note based on the reading that you have done. And remember, it's not just, sometimes you don't just have case note, but you have relevant documentation as well. You have to look at that also. You need to, you know, understand what you have in there. Read everything from marital status to admission, discharge dates, reason, you know, for admission, social and medical, but everything and that you have under the case note, you need to read that, analyze it. Once you know the task, as you're going through the case notes, of course, you are getting to understand what exactly you will need. Then at this point, which may come together with the analysis and selection, or will be done afterwards, you try to connect, you know, case note, relevant case note to each other. So how do I, for example, take an information from medications and add it to medical background as I write, let's say, the body part or a sentence in the body part of the letter that I'm writing? Should be able to organize the case notes, the relevant case note that you've selected, so that, you know, you have the most efficient way of putting these together, these case notes together, to communicate with the intended recipient of the letter. Make sure the analysis and selection, you know, you do good with that particular stage, and do not ignore that part, because it actually determines what you do in the rest of them. If you don't, if you're unable to select the relevant case notes, then organizing them would become a problem. So make sure that you select the relevant case notes. Come to the organization stage, then you're trying to join a case note here, a case note there, bringing them together to form, you know, a complete sentence, either simple, compound, or complex, whichever one is appropriate. So as you mark them out using arrows and making notes on them and all of that, when you're done, you transform. And this is where you are expanding the case notes into grammatically correct structures. The organization part is where you're just linking this case note to that, or saying that, okay, this case note would come after this when I'm writing the letter. And don't forget, I'm referring to relevant case notes at this point, that this is coming before this or after this. You need to be able to have a structure, you know, the layout you're doing, introduction, body, conclusion. So what am I bringing into the introduction? What am I reserving for the body? And then for the conclusion, you need to be able to organize at this point. And you shouldn't just be organizing mentally, you should be writing something down. Then you're transforming the relevant case notes into grammatically correct structures. And this is the point at which you're going into the 40 minutes. At the point when you're transforming, it should be at the end of the 5 minutes where you're going into the 40 minutes. And you have 40 minutes to do the transformation, to write grammatically correct sentences, arrange the information logically to help the intended recipient understand the information you're putting across. And when you are done, still within the 40 minutes, you make sure that you proofread your work, you edit it, do the necessary corrections. If you have to cancel, you just cancel neatly and write what you have to write. If you have to insert, you indicate that accordingly, and then you write whatever it is you want to insert. If you're able to do the analysis, selection, and organization very well, the stage at which you're going to transform the relevant case notes will become fun for you, become easy for you. But if you don't do the first two very well, then you'd be sweating so much on the day, or even when you're practicing. So do that. Then the editing part also becomes simpler for you during the writing process. How do you transform? We talked about transforming. This is where you're writing the letter. So how do you do that? You're given case notes and you are asked to transform them. The instruction says expand the relevant notes into complete sentences. How do you do that? You can add articles. And the, of course, it should be appropriate. You cannot say and patient. No, you cannot say that. So appropriately use the right article. There will be the need, because most of the case notes come without articles. Then you should avoid listing. We'll see examples very shortly. I just want us to go through them. Avoid listing. So you've been given, let's say, symptoms. You mention this symptom, bring a comma, mention this next one, bring a comma. It's not an effective way of writing the letter. So you should avoid doing that. Then you should add other parts of speech. Probably you would need a preposition, you would need an adjective, you would need an adverb, you would need, an article, also part of which is also part of speech. You would need all of these to help you get the grammatically correct sentences that you're supposed to write. You should think about tenses also. That will be clear from the case notes that you have. You would know whether it's in the past or the present or in the future. You can definitely tell. And so you include that while you're transforming. Then at some point you may need to change the word order. Bring one word before the other or take it after the other. You have to think about, constructing sentences. A sentence is a group of words that conveys a complete information. It has a subject and a predicate. The subject is either a noun or a pronoun, or sometimes a nominal. Words that are not traditionally nouns, but they are used as such in particular context. Those are known as nominal. So either a noun, pronoun, or a nominal. Then you need a predicate part, and that is the verb part. Of course, it would include all the other parts of it. That's why it's known as predicate. So you need a preposition there, the other parts of speech, and all over there. It should convey a complete thought. Remember, you need the subject and the predicate, and the predicate is the verb part till the end of the sentence you're writing. So let's look at some examples of what I've listed over here as ways of transforming the case notes that you have. The case notes are in, is it red or orange? Well, it's a shade of something. So I'll refer to that color. The first one, I refer to that as orange, and the other one as blue. I hope that's okay by you, because I'm really bad at colors. So it says 6-week progressive. So the progressively, then there's an arrow, which means it's going up, whatever it is. Then pain, then we have R and L, knee joints. That's what we have. So how do we transform this? An example of transforming this, and you're adding an article at some point. So the patient, we need a subject here. So the patient is the subject, has a 6-week history. This just gave us 6 with WK, which is week, the short form of week, and then history. If you're writing a grammatically correct sentence, we need an adjective or adjectival to describe history. So 6-week hyphenated becomes the adjectival, and we need an article a or the article a to, precede the adjectival. So the patient has a 6-week history of increasingly, over here is progressively, and this is another good point we need to take care of, or we need to bear in mind, to try as much as possible to paraphrase. Do not use the same set of keywords used in a case notes. But of course, if it doesn't come to you readily, do not stress yourself and to say that I have to do it at all costs. Before the test day, you need to practice, look at, paraphrase versions of certain keywords you find in case notes. It's a good preparation start point for you before the test. So progressively, I've replaced that with increasingly. And the arrow going up there is growing, then pain in his or her. So referring back to the patient, once we don't know the gender of the patient now, I cannot tell. But of course, when you refer to particular case notes, you'll be able to tell the gender of the person by the name of the person. You will definitely be able to tell. So in his or her right and left knee joints, I don't have to do R and L, because I'm thinking to write, very complete sentence, and it's not logical enough to just write R and L while you're transforming and expanding the case notes that you have. So this is what I have done for this particular first case notes. And remember what we have here. The case notes I'm using for examples have really nothing to do with each other. They are not based on one particular patient. I selected it from different case notes. Depressive symptoms, then into bracket reclusive, antisocial, irritable, agitation. This is on the point of you avoiding listing. So you could simply say the patient has depressive symptoms such as reclusive, antisocial, irritable, and irritable tendencies. The patient also becomes agitated sometimes. Instead of just using comments to separate, the symptoms as you have in the case note, you may want to, not do that and bring them together in either a compound sentence, a complex sentence, or in 2 simple sentences, whichever one. So what I have done here, it has been confirmed that the patient experiences signs of depression, including a tendency towards reclusive and antisocial behavior. He or she has also demonstrated symptoms of irritability and agitation. Symptoms of irritability and agitation. So that's what I've done to avoid just listing. Then the next one, current situation, colon, there's an arrow pointing down, which means it's decreasing ADL. And what is ADL? You need to know what this means, because this is for nurses. And so once you're a nurse, you should be able to tell what that is. Stopped accessing local shops and friends within walking distance. How have I transformed that? With regard to his or her existing condition, the patient has reduced her activities of daily living as she has stopped accessing shops in her neighborhood and visiting friends who live nearby. You need to think about tenses or other parts of speech, adding other verbs or prepositions or whatever it is to make this a very complete sentence. So the first part, with regard to his or existing condition, I try to add something to it before moving on to the next thing. Then let's look at word order. Medications, OA. What you need to know what OA is. Hyphen glucosamine 1500 mg daily. Think about, changing the word order, because usually you have, if you're writing a very complete and grammatically correct sentence, you should bring the dosage before the name of the medicine. It's more of the logical way of ordering that. So in reference to medication, the patient takes 1500 mg of glucosamine per day for osteoarthritis. That's the OA, osteoarthritis. So I have changed the ordering of the words over there to reflect a very grammatically correct sentence. Then the last example, the case note says daily dressings, surgery, incision, sites. On a daily basis, adding, other parts of speech. Of course, thinking about the tenses as well. On a daily basis, dressings of the surgery incision sites are needed. Dressings are needed. So don't look at dressings and think it's singular. So dressings of the surgery incision sites are needed. So this is what you'll be doing basically. Once you're able to select the relevant case notes, you have to expand them into complete sentences. This is one way of getting your 180 words after all. So you have to do that. Now let's come to paragraphing. You need the introduction, the body, the conclusion. For the other structural features, we'll look at them when we get to layout of the letter. At this point, we are just looking at the main content of the letter, which is the introduction, body, conclusion. What do you do at that point? The introduction has the purpose of the letter. Why are you writing the letter? What type of letter are you writing? And what is the main issue? Sometimes you need the name of the person over there. Sometimes you don't need it. It depends on the writer. But these three pointers should be the purpose, main issue, and then type of letter, arranged in a very logical order, not necessarily going with how I've put it. Sometimes the type of letter you're writing may come first, and the purpose, and then the main issue. These should be in the introduction, which is the first paragraph that you have. Then in the body, you talk about the primary relevant information or the relevant details about the main issue. Then you go to primary and associated relevant issues. This may be in 2 separate paragraphs. You need about 4 on the whole. So 1 for introduction, probably 2 for body, depending on what you have, the case notes that you have. 2 minimum should be enough. And then you go to the conclusion. The conclusion usually expresses the optimism that your request with regard to what you want the intended recipient to do for the patient would be done. Or as frequently seen in OET, you just tell the intended reader that you are always available if there are further inquiries or questions about the patient. Whichever way you conclude it, that's up to you. But these are, the 2 ways of actually concluding a formal letter. Introduction has a main purpose, main issue, and then the type of letter. The body, you're looking at the primary details about the main issue, then associated relevant information. Then you move to your conclusion. You can do the indented style of paragraphing, where each paragraph, the beginning of each paragraph, moves away from the imaginary margin, because the answer booklets wouldn't have a margin. So you imagine it, which is just some few inches away from the edge of the book. Then you start your paragraph, and if you're doing the indented. But if you're not, all the paragraphs are in a straight line. The first sentence doesn't shift inside and all. So this is what you're doing for paragraphing when it comes to the main content of the letter that you're writing. So how do you structure this? How do you structure this? By what format or on what basis do you do the introduction, body, conclusion? On what basis? Especially when it comes to the body. For the introduction, you don't have too many options. It should definitely include the purpose of the letter, the main issue, and then the type of letter that you're writing. But then when it comes to the body, how do you structure that? What is your rationale? Or on what basis do you structure the body paragraphs? Are you looking at priority? So you have the purpose of the letter in the introduction, or the main issue in the introduction. Then you come to the body where you have the details, then associated issues, then recommendations, discharge plan. In that order for the introduction, body, conclusion. The introduction has the purpose or the main issue always. The purpose, the main issue should be in the introduction always. Then you come to details of the main issue, you come to associated issue, recommendation, and discharge plan. That is if you're going with the basis, the priority format. So you're thinking about priority, which one is very important to help the intended reader, take care of the patient very well. Sometimes you may want to go according to chronology, then you're looking more of dates and days. Purpose, straight to the introduction, main issue, straight to the introduction. Then you have first or relevant visits. So the first visit, then relevant visits, then latest visits, then recommendation, discharge plan. So you want to create the 2 paragraphs for the body based on first or relevant visits, latest visits, recommendation, and or discharge plan. It's not really advisable to bring the recommendation, discharge plan into the conclusion. Then if you're not going according to priority, how urgent or important the issue is, and you're not doing chronology to looking at dates and days, then you may want to look at problem and solution. Purpose, straight to introduction, main issue, straight to introduction. You look at management of main issue. So problem, then the solution. How would the case or the situation be managed? And that depends on what you need the intended reader to do for the patient. That becomes the management of the main issue. Then secondary issue and management, then recommendation and discharge plan, and then you move to the conclusion. All these 3 are okay. Remember, we are looking at the best approach, and I told you there are options. So you choose which one would work best for you, and also which one would make that particular letter you're writing for you to select and organize the relevant case notes effectively. You may say that, okay, I'm okay with chronology because it looks like it's the easiest to do. But then in another context, if you're going by this approach, you may not be able to write a very good letter. So in addition to looking at what you prefer, your preference, you need to think about the context to the type of letter you're writing and the case notes or documentation that you have to do that. Thank you so much for your time. It's been great coming your way. I hope you get the very best, and we are always available. You can call us, you can get in touch with us to talk and to solve questions. I am always available to answer your questions. So you know what to do. I'll see you and have a great day.